the recording. Under Chairperson's business, a number of items. I just want to advise members that the committee received a briefing on connected health just before the recess. I think that Mr Dunn had lobbied for. I'm seeking agreement that we write to the department on clarification. There was an issue raised about the North West Health Innovation Corridor and the next steps. So I'm seeking agreement that we write the department to get clarification on that, because it wasn't Hansarded. I think it would be useful if members are in agreement to do that.
Great.
Thank you. I also want to advise members that research services are providing sessions on scrutiny of in-year monitoring rounds for all of the committees, and we have our session on Wednesday the 24th of September from 1:30 to 2 p.m. in room 29. If members could note that in their diaries. Also advising members that an organisation called Drink Think, and I know a number of members attended their briefing session yesterday, they have requested to attend the stakeholder event on the 8th of October, so I'm seeking agreement that we invite them along.
Great.
Item 5 is the draft minutes of the meetings on Wednesday the 2nd of July and Wednesday the 3rd of September. The draft minutes are at page 84. Are members content with the minutes? Okay.
Great.
Item 6, members, is the proposed amendment to the Safeguarding Board Regulations 2012. Just want to remind members that the committee originally received correspondence from the department on this matter on the 2nd of July, which is at page 93. At that time, the department had carried out a very short consultation on the proposed changes, which was effectively 2 weeks, and it had not indicated whether organisations supported or opposed the proposals. I would suggest, given the importance of the role of the Safeguarding Board, the committee had agreed that 2-week consultation and not building in time for committee scrutiny was unacceptable. The committee had wrote back to the department and requested that it deferred making the rule until the committee had a proper opportunity to scrutinise it. The Minister has replied to the committee on the 11th of July, which is at page 92, and his response is helpful and is welcome, obviously. He had agreed to carry out a further 6-week consultation over the summer, and officials are here today to brief the committee on the proposals and the outcome of the consultation exercise. The revised SL1 is at page 45 of your tabled papers. I want to also advise members that the Children's Law Centre initial response to the consultation on the proposals and a follow-up letter from the department in relation to the reissued consultation have been circulated just today, and they are on people's tables. So I want to welcome Ailish McDaniel, Director of Family and Children's Policy, Donna Rudy, Head of Child Protection Branch, and Paul McConville, Social Services Professional Officer. So I'm going to, maybe if you want to make a few comments initially, and then I'll invite comments from the members.
Okay, thank you, Chair. I'd like to begin by apologising to committee members for the lateness in which the SL1 was submitted to the committee for consideration, both for this session and the last committee meeting before summer recess. I welcome the opportunity to update the committee on proposed amendments to the Safeguarding Board regulations. I understand that members were concerned both in relation to the duration of the initial consultation period and the department's failure to report on the outcome of consultation, and I will address both of those points today. The department proposes to amend Schedules 1, 3 and 5 of the regulations to alter the quorum requirements for meetings of the Safeguarding Board, Safeguarding Panels and Case Management Review Panel, and those panels are statutory subcommittees of the SBNI. Currently, at least 2/3 of the membership of the board and its panels, including the chair or deputy chair, must be present for a meeting to be quorate. With the commencement of the thematic review linked to child sexual exploitation, it emerged that it is likely that the SBNI would encounter quorum difficulties because more than 1/3 of its membership was likely to have to declare an interest in the 22 cases under review. Under existing SBNI regulations, members who declare an interest in any matter under discussion are prevented from taking part in discussions on the matter and from voting on it. It's proposed to amend the regulations to reduce the quorum requirements to at least 1/3 of the members, including the chair or deputy chair. and this will ensure that meetings of the SBNI remain quorate and at the same time ensure that any conflicts of interest are properly managed. We initially undertook a 2-week consultation on the proposed amendment to the quorum requirements in June 2014, and the reason for the short consultation period was to enable us to bring the amended regulations into operation during the summer and thus allow the ongoing SBNI thematic review to continue with minimal interruption. As it transpired, an extension to the time frame for the completion of the thematic review was sought by the Chair of the SBNI on behalf of the Board in June, and the Minister has now agreed to a 3-month extension, which means that the review will report in March 2015 and not in December 2014, as was originally planned. The extension to the time frame for the review enabled us to consult for a further 6 weeks on the proposed amendment to the regulations linked to quorum requirements, and at the same time we took the opportunity to consult on our proposal to include a designated doctor for safeguarding children in the membership of the SBNI, which also requires us to amend the SBNI regulations. It was always intended to include a designated doctor in the membership of the SBNI, but we had to wait until the Health and Social Care Board was able to successfully appoint a practising paediatrician to the post. In total, the Department received 14 responses to consultation from a range of organisations, 9 during the 2-week consultation period and 10 during the 6-week consultation period, and 5 organisations responded to both consultations. There was overwhelming support for the proposal to amend Regulation 3 to include a designated doctor in the membership of the SBNI, and on the quorum amendments, the majority of those who responded, 9 out of the 14, were supportive. The Department considered the responses to consultation in detail and identified a range of options, and in the consultation summary report, which we've included in your papers today, we explore those options and provide a rationale for any decisions that were made. And in connection with the quorum proposal, a number of options were considered, and I can go into those options if you want me to, Chair, but they are considered, they are set out in the consultation summary report.
No, it's okay if they're in the report, if we can tease them out if we need to.
Okay. As a result of all that we considered, we remain of the view that the option to reduce the quorum requirement to at least 1/3 of the membership, with voting rights being present at SBNI meetings, is the only viable option which can be delivered within the time frame available to us at this stage. We did consider the quorum formula proposed by the SBNI in some detail, but concluded that a quorum of at least 1/3 requires a minimum number of members to be in attendance, below which a meeting of the SBNI will not be quorate. The SBNI formula, on the other hand, relies on a combination of numbers of members in attendance and numbers who declare an interest, which could bring the quorum below 1/3 of the membership. And in addition, a quorum of 1/3 is adopted by a number of local safeguarding children's boards in other parts of the UK. The Department intends to undertake a comprehensive review of the SBNI, and indeed gave a commitment to the committee to review the SBNI during the passage of the primary legislation which established the board. With the final approval of the Minister, the review will take place on conclusion of the ongoing thematic review into child sexual exploitation in 2015. And as part of that review, we will revisit the proposed 1/3 quorum requirement and the issue of deputisation, which was also raised in consultation. We will start making preparations for a review soon, and will advise members of the committee when the proposals are firmed up. And that concludes the presentation, and we're very happy to take questions from members.
Okay, thank you, Eilish. I mean, obviously this is critical piece of work, as is the role of the Safeguarding Board. And we've seen only too well the very real issues around safeguarding when we look at the scenario in England over the last number of weeks and months. But it would seem to me that there is a question around the response in terms of amending the legislation to reduce the quorum. You know, is that an adequate response to this issue? Because it seems to be that this issue has arisen because of a number of conflicts of interest with individuals who are maybe involved in other processes. And it would seem to me that what the Department should be doing is addressing the independence rather than reducing the numbers of people.
I don't think that there is anything that can be done at the minute to address the independence point with the ongoing thematic review. I think we are where we are with that. I think around 15 members of the committee will have some association with the 22 cases under review. Now, we've got one of two options here. We cease the thematic review to enable us to deal with this in another way, or we continue with an amendment to the regulations to allow the review to continue, and we're giving members a commitment that we will review the SBNI in its totality on conclusion of the thematic review, but that wouldn't happen until next year. And we will consider, among other things, the membership of the SBNI and the independence of the membership of the SBNI.
But, you know, what I would say in response to that, simply saying we can't currently deal with an issue of independence is the wrong message in relation to safeguarding, in my view. And, you know, if we've learnt anything over the issues around Rotherham, it was a need for independence in these processes. And it just, I would have a concern that what is being proposed here is a permanent issue in terms of a quorum. You're effectively amending legislation, which is a permanent issue. So this sense that we'll do this now and then we'll come back and review it doesn't stack up in my book.
One of the things that I should say, Chair, is that in terms of independence of the thematic review, I mean, there have been a number of mechanisms actually built into the review to give it some degree of independence. So, for example, there are a number of independent file reviewers that have been appointed. A team from Queen's has also been appointed to undertake an analysis of the file reviews that are undertaken. The report will be authored by Queen's, and the SBNI has also availed of the services of a number of individuals, a number of senior individuals with an interest in safeguarding from England, and they too will add some level of independence to the thematic review process.
Yeah, and I don't doubt that, Anish, but you know, we've acknowledged that there's a problem. We've acknowledged that there's been a number of conflicts of interest, so much so that there's a proposal to amend the legislation.
Yeah.
You've acknowledged in your own words that we can't deal with the independence issue now because of where we're at in the review. I mean, this was pointed up at the start of the issue around child sexual exploitation. And we questioned, and I know I personally questioned, the need for a twin-track process on this. I mean, would it not be more appropriate that these 22 cases, in the interest of getting the right answers to this horrible issue in our society, is actually dealt with in the inquiry?
Well, the inquiry will consider children in care. Now, it will not necessarily consider the 22 cases being reviewed by the SBNI. I think the point that I'm trying to make is that we have tried, and the SBNI has tried as best possible to build independence into the review process, and I've outlined some of the mechanisms that are now in place to do that.
Yeah, but it would go back to the point, by reducing numbers to a quorum, I think, of 6 people.
It would be.
You know, what does that say in terms of shared responsibility and independence of processes? It doesn't seem to me that it's an adequate response, but there's a number of people have indicated that they wanted to comment on this. I have Joanne first.
Thanks, Chair, and you've touched on what I would like to ask as well. Can I thank you for your briefing? And I think these issues are far too important for there to be a problem with the board, and it's important we don't allow the effectiveness of the board to be in any way put at risk with the difficulties with administration. And like the Chair, I would be concerned, and think we're joined by the Children's Law Society, and the changes of the quorum and how that will resolve the conflict of interest. Could you outline a bit more about your rationale for reducing the quorum, and in your opinion, will the decisions taken by the board improve as a result of reduction of the quorum requirement? I'm not convinced with it, so could you maybe tease that out a bit more?
One of the things that I will say is a quorum of a third is not atypical, and I can give you a number of examples where a quorum of 1/3 actually applies. Tyneside Children's Safeguarding Board uses the 1/3 quorum. Southampton Local Children's Safeguarding Board likewise, and Walsall Children's Safeguarding Board likewise. So it is not atypical of a quorum for a safeguarding forum to actually apply. I mean, we did look at, I mean, the SBNI itself came up with a formula that it thought would work. My concerns about that was that it actually could lead to a smaller number than 8 being required to be present for the meetings of the SBNI to be quorate. The point I'm making, not atypical at all, and there are a number of other examples, particularly in England, involving local children's safeguarding boards, where the quorum of 1/3 actually applies.
So do you share then the concerns, the very real concerns from the Children's Law Centre, that the independent review is required, and as I said earlier, the reduction of the quorum requirement is not the way to go about resolving the conflict of interest issues?
I think it's the only solution to us available at the minute if we are going to continue to have the SBNI undertake the thematic review. And quite frankly, I think we've gone quite a considerable way down the road to begin to reverse that at this stage. I mean, I will say that the board has made fairly significant progress to date, is continuing to review files, and as more cases are released from Operation Owl, we'll also review those files. So I don't think it would be sensible at this stage to halt that process in the interests of us learning from all or some of those 22 cases.
One final point, Chair. Just finally, reading from the board's own website, they say, and I quote, "Children are more likely to be protected when agencies work in an all-inclusive, coordinated and consistent way." So how do you feel then the changes that you are proposing will impact on that coordinated, consistent way the board itself would operate? You know, in your opinion, is the board currently working in a coordinated manner in line with the purpose for which it was first set up?
My view would be that it is, and indeed all of the members are actually under a duty to cooperate with the board and with each other. I think the thematic review is unique, and it has created a set of circumstances that I think would not otherwise exist within the SBNI. And the other point that I will make too, it will be at key decision-making points during the course of the thematic review that this will actually become an issue. So, for example, when the SBNI comes to sign off the final report, quorum issues are likely to emerge. That doesn't mean that member agencies will not have sight of the report for factual accuracy checking, for example. But when it comes to key decision-making points, there will be members of the board who will have to absent themselves from the decision-making process. But those decision-making points will actually be few along the way.
Yeah, thanks, Chair.
Okay, Jim?
A couple of things. Does it not concern you that 9 groups, individuals commented within the 2-week period, but actually 10 commented outside the period? Or is there an overlap?
There is actually an overlap. There was 5 that responded within the first 2 weeks that also responded. In the 6 weeks,
Yes.
there was 9. There was only 5 additional responses.
I can understand that, because presumably the 2-week one was a rush job to get it in, and then they expanded upon their observations when they had more time.
I think they took time to
Yes.
consider what was being proposed.
And
Yeah.
in the additional 5 new observations or consultation replies, was there new material that it hadn't occurred to you?
I mean, I think one of the issues that emerged was the issue of deputisation. I mean, it is a linked issue, but and it's something that I do genuinely think that we need to look at. So in terms of new issues that emerged in the second phase of consultation, that's one that I would actually point to. but it is something that I do think that we need to look at in the longer term.
But we would never have known about that had we simply rubber stamped this and let it go through within the 2 weeks.
But the point is, Chair, that the intention is to review the SBNI in its totality. So all of those issues, I think, will be up for consideration when we do review. And we've already given a commitment that this will be done. I think the initial commitment given was that we would review after a year. With the commencement of the thematic review, a decision was made to delay a comprehensive review of the SBNI until that exercise concludes. But the intention is to put everything onto the table at that point, including the legislation that established it, the membership of the SBNI, issues like deputisation, quorum, etc. All of those issues will be considered.
But is this not going to occur in the future? Because presumably there will be other investigations and issues where there will be quite a few of the board members who at some stage in their careers have been involved. I mean, is it the fact that maybe the people who've been appointed have too much of a vested interest in the structures that we have to be independent?
And maybe it is how we structure ourselves to do things. So if I can give you another example of a statutory function of the SBNI. The SBNI undertakes case management reviews all of the time. So when something goes wrong with a case, or indeed when something goes right with a case, the SBNI has a statutory function to actually review that case. Now, the reviews are actually undertaken by a panel of the SBNI. So you're quite right. There may be some structural issues that we might need to address if we were to position an exercise like the thematic review with the SBNI in the future.
Is there not a hybrid compromise here that where there's a situation where there's a considerable number of people who have to declare an interest and absent themselves, you have the lower quorum, but that the normal quorum for day-to-day administration is at a higher level?
I mean, it is something we're willing to consider. It is something that could be considered as an alternative response to this issue.
Because we've all read about Rotherham and the dreadful situation that went on there. And I was actually in the chair when the original legislation setting up the board was established, and then it was finalised when I was deposed or left. I don't know what happened, but I certainly wasn't the chair at the end. But we're absolutely determined that nothing happens in Northern Ireland of anything like that scale with this board in place, and therefore public confidence in its independence is absolutely essential. And I would have thought that for the day-to-day administration, normal quorum rules should apply, and only in the specifically difficult issues will there be a default position of 1/3 in attendance, which I think gets you around your problem, but doesn't, in my opinion, reduce public confidence in the body.
Thank you, Jim. Fergal?
Thank you, Chair. Just reading from your own paper here around the consultation heading, and you say this is to ensure that we can do all that we can to avoid the perception of bias. So you're dealing in perceptions, and it's the public confidence issue there that Jim likes about. But aren't you in danger of replacing that with a subsequent weakened decision-making process because of the reduced number of members making decisions? And doesn't that lead to its own perception, which may undermine public confidence?
If the department was implementing something that was not in keeping with practice elsewhere, I think I would have concerns. But I think we have to draw some comfort from the fact that other local children's safeguarding boards, for example, and I'm only drawing on a number of examples from England, the same practice is applied there. The other thing that I would say is I think it is a bit of a fallacy to create the impression that the SBNI can be totally independent, because it is not. By virtue of its nature, it is made up of bodies who have an interest in child safeguarding. I mean, they are members of the SBNI because of what it is they do on a day and daily basis, like the board, like the trusts, like the PSNI. So, I mean, I think it is a bit of a fallacy to create the impression that it is wholly independent. The independence that we introduced into the SBNI was by way of its chair. which is not in keeping with safeguarding board arrangements in other parts of the UK, where independent chairs may not necessarily be in place. And we deliberately kept the SPNI separate from the Health and Social Care Board, for example. So other local children's safeguarding boards in England and Wales will be cited within the local authority, and that's not the case in Northern Ireland. So we've done everything that we can to introduce a level of independence, but those bodies who are around the table are there because of what they do on a day and daily basis to safeguard children.
Yep. You've got what you've got, if you like, and as you stand now, is the real risk that the board couldn't make decisions in relation to this.
I mean, it's estimated that around 15 possibly will not be able to participate in key decision-making points. And I'm not saying that they will not be able to participate in all key decision-making points. You've got a membership of 29, so there are still considerable numbers of people around the table who are making decisions, including the Children's Law Centre, I have to say, which is a member of the SPNI. And is unlikely to be affected by the independence issue or the declaration of interest issue.
But back to the perception issue, and isn't it important that you take all decisions conscious of the public mind and not introduce the perception that you're merely shifting the goalposts?
I don't think that we're shifting the goalposts necessarily. I mean, we're trying to introduce an arrangement which is more workable than the original arrangement that we introduced in light of what is actually happening now in operation. I mean, this is the second time that we've had to amend the SPNI regulations because of issues that are emerging in the operation of the board. I don't necessarily think that that is unexpected in light of the fact that we've got a new board operational for a very short period of time. I do think there were always going to be issues that would emerge in the course of its operation in the early days. If I was still doing this 5 years from now, then I think there would be an issue.
Yes, but just finally on the perception issue, and it's you has introduced the concept of perception and perception of bias. Isn't there a danger that you're also introducing another perception for the action that you're trying to take?
And I think some of that has to be countered by, and I'm talking specifically now about the ongoing thematic review, some of that has to be countered by the elements of independence that we have sought, the SPNI has sought to build into the process of review. And I think those independent elements are actually quite significant and potentially quite powerful.
Okay, Chair, thank you.
Okay, thank you, Farrell. I have Roy next.
Thank you. Can you tell us what the options you considered? Because this is a very dramatic reduction in quorum from 2/3 to 1/3.
I think one of the first things that we looked at was actually enabling the SPNI to do this by way of standing orders. So, and again, that's the practice that is adopted in England and Wales. Wouldn't work in Northern Ireland simply because it would require us to change primary legislation to make that possible. And on legal advice, we were told that could not happen. The other option that we considered was to redraft the Declaration of Interest regulations within the set under consideration to allow members in exceptional circumstances to actually remain while discussions were underway and to factually contribute to or objectively contribute to those discussions. And the third option then that we considered was to redraft the Declaration of Interest regulations to permit any member who declares an interest in a matter just to remain for discussion, but to prevent them from either participating in discussions or from voting on any matter in which they have declared an interest. And again, on the basis of legal advice, both of those options were rejected.
If this amendment doesn't go through, what will be the consequences?
I think there are potential difficulties for the thematic review.
What does that mean?
Well, the thematic review couldn't continue because obviously...
Couldn't make decisions?
Well, there are a number of points along the review process pathway where decisions will have to be made, and I think principal among those is the final sign-off of the report. So we wouldn't get a report from the thematic review. Essentially, is one potential consequence of us not doing this.
Okay, and how did you pick the figure of 1/3 rather than 50%, for instance?
Again, drawing on practice from elsewhere. I mean, that was one of the things that we considered, and we looked at the numbers too. You know, what would make the thematic review work, and 1/3 was the option that we decided upon.
You think 50%, for instance, wouldn't work?
50% could cause problems, yes.
Okay. The other way of avoiding loss of quorum would be if individuals who have a conflict of interest were to leave and others to come in. Is that a practical solution?
You have a membership of the SBNI. The membership of the SBNI is specified within legislation, so no, it wouldn't be possible.
Would that not be amended? Is this legislation changing here?
Well, we would need to amend the regulations then to amend the membership of the SBNI. I don't know. I mean, we've got a membership of the SBNI that is as extensive, I think, that it is going to be and needs to be. So realistically, I don't think that it is an option.
Have we a practical difficulty in Northern Ireland being a relatively small place with key people having come across one of these 22 cases? Is that one of the practical difficulties?
I don't think it is a people issue. It is an agency issue.
All right.
I mean, the 22 cases are children who were in the care system, in the care of the trusts, and unfortunately, the 22 come from 4 of the 5 trusts. Obviously, the board has an interest. The police was involved in some of those cases. Probation board potentially involved in some of those cases. The Youth Justice Agency may also have had an involvement with some of the 22 cases. And I could go on. So it isn't an individual issue; it is an agency issue.
You've said there clearly are independent people on the Law Centre, for example, on the board. If they were not satisfied at any point, would they be able to carry out a minority report or express concern?
I mean, as members of the SBNI, I think there is an onus on them and a duty on them to express any concerns that might emerge in the course of the review and decisions relating to the review. I mean, you do have 3 lay members on the board. You have a number of voluntary sector organisations, including Bernardo's, NSPCC, Include Youth, Children in Northern Ireland, and the Children's Law Centre are all represented on the board. I think there would be an onus on any member who thought that something needed to be challenged to mount that challenge as and when it was required.
Okay, thank you.
Okay, just before I bring in I think is next. In terms of options, has it been considered that the 22 cases simply be part of the independent inquiry?
It hasn't been
Why not?
considered. Well, I think the inquiry has been running now for quite some time and is due to report, I think, now in November of this year. So we would delay the independent inquiry if we did that.
How would we
Also,
delay it? How would we delay it?
Well, I mean, I think they then need to take the time to consider all 22 cases.
But the inquiry, are the inquiry not considering the cases to date?
The independent inquiry, the Kathleen Marshall led inquiry is not looking at specifically at the 22 cases. It is looking at children in the care system, but not specifically at those 22 cases. The whole point of the SBNI review was to take all 22 cases and adopt its case management review process to some extent, and to look at all 22 and to see what themes were emerging from all 22 cases that we could actually learn from. So it is in keeping with what the SBNI does as part of its day-to-day business. The only difference being, rather than looking at one case or reviewing one case, it's looking at 22 and trying to identify themes that emerge across all 22.
Okay, I'm going to bring Pam in.
Thank you, Chair, and thank you for your presentation. Just a bit more information. You speak about the one-third quorum by other local safeguarding boards. Is this because of similar conflicts of interest? Do you know what reason they have for having the one-third?
Not absolutely certain. There may be an element of that where they've had to bring the quorum to a level where they are able to address issues that are of interest to members around the table. The membership of the local children's safeguarding boards will be similar to the members of the safeguarding board. So you're quite right. It may be one of the reasons why the quorum levels are set in the way that they are.
Okay, and the actual conflicts of interest themselves, we're assuming we know what kind of conflicts they are, but can you give us any more detail or examples of what some of those conflicts of interest are?
Well, if all 22 children were in the care of four trusts, then obviously they have an interest in the 22 cases, the 22 children for whom they cared. The board has strategic responsibility for safeguarding. In that way, it has an interest. I've made the point some children will have been in the custody of the police, for example, and for that reason, the police have had an interest. I mean, what you need to understand is, these are fairly complex cases involving very vulnerable children who unfortunately will have had an association with the system quite widely.
Okay.
And for that reason, a number of different agencies, or a large number of agencies, are likely to have an interest in at least some of those cases.
So it would be very difficult to avoid conflicts of interest then in these cases?
Yes.
Okay, and the Safeguarding Board has been in existence since 2012?
Yes.
And nobody foresaw these problems coming up back in 2012.
At that stage, we hadn't anticipated the SBNI undertaking a thematic review. It's one of the reasons why a more comprehensive review of the SBNI is actually needed. I think to make certain that what we put in place in 2012 we've got right, and if we haven't, I think we will need to consider what we need to do about that.
Okay, thank you.
Thank you, Pat. Mickey?
Yeah, thanks for the presentation. I was on the committee as well when the safeguarding legislation was introduced, and it was my understanding that we were aiming for the best possible safeguarding board, irrespective of what happens in Britain. And looking through the material presented by the Children's Law Centre, it seems that their concerns really haven't been addressed, and they are talking about having an independent outside agency like the inquiry that is already ongoing. So there is a facility there that could actually deal with it. I mean, you talk about the delay, but surely you talked about these are complex cases involving vulnerable children, and surely those vulnerable children deserve the best possible outcome. So we're talking really about technicalities and stuff like that, about quorums and all of that. Ultimately, we should be thinking about the best possible outcome for these children, and I'm not sure, from what I've read from the Children's Law Centre, that actually might happen. Because obviously you're saying that whatever number of members, some of them at some stage may have conflict of interest. So what happens if you go to a number for the quorum and then you find that instead of whatever number that more than 2/3 have a conflict of interest? How do you address that?
I don't think they were going to have more than 2/3 with a conflict
I'm not,
of
I'm
interest.
being devil's advocate here. We can't actually say that definitely, you know, so where does that leave the situation then? You know, because obviously a lot of the people that sit on the board have worked for the trusts or whatever, have had contact, and all of these children, I presume, have been at some stage in care, going through that system. Maybe not all of them, but you know, you could have actually arrived at that situation. So
I suppose one of the things that it perhaps points to is, I mean, I think in future, if we wanted to do something similar, you know, maybe we need to consider where we actually cite the exercise. So, I mean, I think that's one thing that we will need to take account of in the
I think
future.
the point was made earlier was it was possible for these problems to have, with a bit of foresight, actually been foreseen to happen because of the nature of the complexity of safeguarding. You know, so that may happen in the future, but putting amendments in, and the chair has made the point, that kind of is permanent. You know, so that's in legislation. Then you're saying about maybe putting in more amendments or changing the legislation. That's a huge issue because it took long enough, I think, and Jim may or may not agree, but it was a huge issue to begin with in terms of the length of time it took for that legislation to be actually dealt with. You know, so I'm not sure that revisiting that, I mean, I would have did assume at the time that, possibly wrongly, that all of the complexities are going to be factored in.
But the converse of that is you've got a significant body of expertise, safeguarding expertise around the table of the SPNI. They are members of the SPNI for
I wouldn't
a
doubt that for a
reason.
moment, but they may have conflicts of interest. Therein lies the problem.
In this particular exercise, the issue has emerged. I don't think it is an issue for the SPNI naturally on a day-to-day basis.
But it still has arisen.
The issue has arisen, yes.
That's the point.
Okay.
Thanks. Thank you.
Right, yeah, Fergal, you had
Just to
indicated
clarify
just
the
a
point,
point.
you have admitted there that there's the potential that the SPNI is not the proper body to be doing this, given the circumstances.
Although I've made the point that it is placed there because of the significant body of safeguarding expertise that you've got around the SPNI table, and that was part of the rationale for placing it there.
Okay, no other members had indicated. By way of conclusion, I mean, thank you for attending. It certainly would be my sense that this isn't an adequate response in terms of amending the legislation around the issue of independence. And I certainly have been left with a number of questions in this regard, and I do refer back to the horrific situation in England and, you know, the multiple bodies that were included in that process, and the need for us not to have any complacency around the issue and to get this absolutely right. But it does, I have to say, it is ring true to the discussion we had when the inquiry was being established, and the need for that inquiry to have proper statutory powers and to have powers and teeth. And, you know, that was alluded to in an evidence session here by Kathleen Marshall herself. And the questions around the role of the Safeguarding Board, and we were told at that time that the statutory powers will come from a Safeguarding Board. And, you know, I would have a number of concerns that this proposal is actually just reacting to a particular set of circumstances, which, you know, doesn't appear to be anyway strategic. I also would suggest to you that we're all too familiar with the pressures in the department. So to simply say that, you know, the review of SPNI will be given priority doesn't hold up much weight either, given the pressures in the system, where the department or your good self might be told there's another piece of work you have to do. And I am concerned about the permanency, because this is change in the legislation. This will have a longer term effect, in my view, and I think, again, dealing with an issue of independence by simply reducing the decision-making powers doesn't necessarily make sense in my view. And the other point I would say is that, you know, you referred to this notion about doing better than what happened, obviously, in England, and then there's nearly a suggestion that we would copy some of what their boards do. So I certainly, and I think you've heard the views of the committee, wouldn't be content to agree to what has been proposed here today in terms of the amendment to the legislation, and I think that the committee can then reflect on the next steps around that. But this is too important to get right, and what I see in front of me today is simply a reduction in those decision-making powers, which isn't really addressing the core issue of independence and the need for us to be foolproof in relation to this, because I've heard a number of comments from yourself about we can't deal with independence now, that it can't go to the inquiry, which wasn't considered. You said yourself it wasn't considered as an option, but then you said it was because it would be delayed. Well, delayed by how long? And have we balanced delay up with the need to get the independence? Right. So for ourselves, and you've heard from myself, for ourselves, I don't think we're in a position to agree to what's in front of us today. Okay, thank you for your time. Okay, members, just in terms of closing in this particular aspect, I'm suggesting, members, that we take further evidence on this issue from the Safeguarding Board. I think it's critically important, as outlined, to get this absolutely right, because this will be a permanent change to the legislation. So people are in agreement with that we seek more evidence in relation to this issue and reflect on it. Thank you. Item 7, members, is the Department Budget and Financial Position. It's on page 99 of the papers, obviously previously provided by the Minister. I want to refer members to the paper from Professor O'Neill and Professor McGregor, which is on page 117. Again, I don't need to remind the members, but the committee did receive a briefing from the Minister on the budget position last week. Members agreed to consider what action the committee would take on this issue today, and we're all aware that the Executive are in discussions around these issues. The October monitoring round will be crucial in terms of how the budget 2014-2015 budget issues are being progressed. The Department will be briefing the committee on its submission to the October monitoring round on the 24th of September, if members want to note that in their diary. And given some of our discussions earlier during the planning meeting, we had agreed that the clerk should draw up terms of reference for a piece of work that will allow the committee to scrutinise the budget for 2015-16 going forward. So in relation to the current issues around 14-15 budget, it was clear from last week that there are different views as to how we have got to the point that the Department has arrived at the position it has. The root causes for the 140 million shortfall, how long these financial problems have been known to the Department, and the relevance or otherwise of welfare cuts. Therefore, as a committee, I don't think it's feasible to have a united position in relation to this, whether we agree with the Minister's analysis of the current position. I think it's particularly useful if we take and give great sight and effort to the briefing on the October monitoring round in terms of going forward. So I'm conscious that we reflected very forcibly and clearly our views on this issue last week. One of the key issues for the committee, as I saw last week, was the current spend and the mismanagement or otherwise of the current spend. That remains my view as to the advice that was given, particularly, I suppose, from DFP and the DFP Minister, and how that's dealt with. And we caveat all of that, and we have done that throughout the process, by saying that we do want to be part of finding the solution to the pressures that exist in the system. However, there is an issue about increased oversight, scrutiny and accountability in relation to budget management. So do members have views at this point? Are members content that what was said last week stands? Kieran?
Yeah, Chair, I agree entirely with you. This is a very serious issue, and we're by no means out of the woods yet. I wonder, Mr McGregor and O'Neill, would it be reasonable to ask them to come and make a presentation, or some other people that would have experts on the funding of the health service in Northern Ireland to the committee to help us along, see where we're going on this very important subject?
I think it may be useful to do that, either in the pieces of work going forward around increased scrutiny or scrutiny of the budget going forward in terms of how spend is allocated generally, or on the wider piece of work around the outcomes. But I think, yes, we can consider those individuals or other individuals in terms of evidence.
Yeah, okay.
Thank you.
Yeah.
Anybody else? Joanne?
Chair, just to point out, I know we went into this in a lot of detail last week, but what I cannot understand is that we're looking at the problems within the budget and financial position from the latter stages of 2011 to 2015, and surely the problems would have been there from the beginning when it was set in 2011. What concerns me is every month the Trust report their position to the board. The Health Service and Social Service Permanent Secretary. Why was this not forecast? Why has it taken so long for these concerns to come before us? And if the financial experts within the department were not flagging up their concerns to the Minister before last year about his budget, then we have to ask whether they're competent with their forecast when finances are needed to run the health service.
Yeah, it's a fair point, and it was made, yeah, Mickey.
Well, we listened to the Minister last week, and what he failed to explain to me is there's $4 billion removed from the budget. I heard a lot about welfare cuts and what might or may not happen, and we had sort of getting bingo figures thrown out. It's gone from $1 billion to God knows what. But the point that I'm making is surely that was factored in, because it was clear that $4 billion was going to be removed from the budget. That doesn't seem to have been taken account of, but now we're in crisis in inverted commas, and it's all being blamed on something that hasn't really happened yet, or hasn't kicked in yet. So, you just wonder at the information sometimes that you're being given. To me it was totally disingenuous, I have to say.
Fergal?
Just briefly, stark in the evidence, I think, last week from the Minister was his admission that there was waste in the health service. He categorised it as a small percentage, but even a small percentage in the £4.6 billion spent in the health service is something between 45 and 50 million pounds, and yet we're not seeing sufficient evidence of how that waste has been interrogated, where it is, and how it you could get better outcomes in the health service if the money were spent more appropriately.
Okay, thank you. No, you're right, Fergal, I agree. And I suggest that, this has been well rehearsed and these issues have been raised, and they have been raised directly with the Minister and the Department, that we need to put these issues again in terms of the briefing on the 24th of September, directly around the issues about knowledge when these issues were brought to the fore, the wastage, mismanagement, all of those key issues. So are members comfortable that they have that in their diary for the scrutiny of the October monitoring round on the 24th?
No, I think, Chair, just briefly, the demand continues to outstrip the budget and the resources that are available. The demand for health and social care continues to grow, and the budget hasn't followed suit, and therefore the money is not available to meet the demand and the requirements. So I think all of us as elected representatives and within our various party groups must do what we can to lobby and put pressure on the executive to find this money, because it's our electorate that are suffering, and we as all are fully aware through our constituency offices of the issues that come up. And the Minister has said no later than this week that the waiting lists now will continue to rise as a result of what is happening. So these are real issues, and we are fully aware of it, all of us. I think we all have a responsibility to put pressure on our various party groups and those within the executive to try and find the resources to meet the demand.
Yeah, I think by way of concluding that, I mean, I think there's been a consistent message that says we want to resolve the issues as best we can, and I think people are working actively to do that. But I also think we'd be failing in our responsibilities if we didn't address the very clear advice we're getting around current spend and you know, words like mismanagement being used. So we would be failing our responsibilities equally if we disregarded that. So yes, your point.
I agree on that. You know, I agree totally. We mentioned it earlier before we went into our official meeting about the budget. 4.6 billion, 75,000 people are employed. How efficient, how effective is the health service? We need to, and again, we need to scrutinise, we need to look at measurements and outputs, and I think we must be more rigorous in that in our work and see and make sure that the place is working efficiently and effectively. Because the general perception out there is that it isn't. And people are concerned about the cost of health provision, because and we all know, you know, give the health service a few more million tomorrow, and they'll be back within 3 months looking for more. So it has to, you know, it really has to be contained and measured. And I think we as a group and as an assembly need to be working together to ensure that.
Absolutely. Okay, thank you for the Roy. Sorry.
I think something which we should be exploring a little bit more is the degree or the information behind the finance minister making the mismanagement accusation. And it's all over this £13 million as I see it, or is there something more? I mean, I think we ought to be inquiring further as a committee as to what details give him concern. One thing that certainly has been in my head was there was a January in-year monitoring bid, for instance, for claims that the minister was expecting, which wasn't satisfied. So, you know, did he break the budget because of legal claims? Is that the extent, or is it more? So we need to find out: is there other issues which are behind the comment of mismanagement? I don't know how do we drag that out.
Well, we could seek clarification from the department directly on that.
Chair, well, I mean, I suppose you would be seeking clarification from
The finance?
Yeah.
We may have to go through the finance committee.
Well, the process is simplified now where committees just inform another committee and they can write directly.
Well, can we propose we would do that?
Yeah, and for information, there was a reference to the issue in the June monitoring round, but equally in the January monitoring round, and there was a 13 million and there was 10 million capital also returned. So if we can seek clarification, that would be useful. Thank you. Okay, members, the next item I have is a statutory rule, Health and Personal Social Services, Prescription of Drugs, etc., 2014. It's on page 241. We had considered and approved the SL1 at our meeting on the 2nd of July. The Examiner of Statutory Rules has reported that he has no issues to raise in relation, so are members content with the statutory rule?
Right.
I'll then put the motion. The Committee for Health, Social Services and Public Safety has considered the Health and Personal Social Services, Prescription of Drugs, etc. amendment regulations and has no objection to the rule.
Right.
Item 9 is another statutory rule, the Food Information Regulations 2014. It's on page 249. We had considered ASL1 and approved it at our 16th of January meeting. Again, are members content?
Great.
Again, I'll put the motion. The Committee for Health, Social Services and Public Safety has considered the Food Information Regulations 2014 and has no objection to the rule, subject to the report of the Examiner of Statutory Rules.
Great.
Item 10, another proposed statutory rule, the Fish Labelling Regulations 2014 on page 291. The purpose of the proposed statutory rule is to amend the fish labelling regulations to extend existing label requirements to show consumers where the fish were caught, if they were farmed, and the species. New fish labelling rules are to apply EU-wide from the 13th of December 2014. The new requirements will provide information on fishery products, including the equipment used to catch the fish and the date of minimum durability. So are members content for the department to make the statutory rule?
Agreed.
11, proposed statutory rule, Health and Personal Social Services, Health and Social Care, Regulations 2014. It's on page 298. The purpose of the proposed statutory rule is to accommodate the new HMRC Protection 2014 facility introduced by the Finance Act of 2013. The rule will also make minor, miscellaneous and technical amendments to clarify the operation of certain regulations. Are members content?
Could I maybe just raise, I'm disappointed reading that no responses were received, and possibly that's quite alarming. Could we maybe suggest the committee write to the department to ask for an assessment of why no responses were received and how widely they advertised and promoted the consultation? Also, Chair, it might be useful to know the cost of carrying out this consultation as well.
Is this in relation to the
Health and personal consultation was carried out, no responses were received.
Okay.
So that's quite
I assume there's a standardised approach to that, but we can seek that clarification. Not an issue. Item 12 is now proposed statutory rule, the Food Hygiene and Official Feed and Food Controls Regulation. It's on page 313. The purpose of this is to provide derogation from the need for the import certificate for seeds intended for the production of sprouts to be accompanied by a signed confirming compliance with EU production regulations.
They speak of nothing else in Kilkeel.
Chair, are you sure we're not in agriculture?
No, that's what it feels like. Are members content for the department to make the statutory rule?
Great.
Okay.
Get it done before Christmas.
Item 13 is matters arising. I want to inform members that there are 27 items of matters arising
Noted.
in the meeting folder.
you can't.
In the interest of time then, I'm
Great.
advising members that I'm going to draw your attention to several of the items, unless members have other issues. Item 13.1 on 323 is a response from the Minister regarding the planned cancer awareness campaign by the Public Health Agency. I'm seeking agreement to forward the response to Pancreatic Cancer UK. Page
Madam
3
Chair,
to...
could I just say, I
Sorry,
think we're all
Jim.
delighted yesterday to see the launch of the ovarian cancer
Yeah.
and to see Una Crudden
It's
featuring
next.
prominently
Yes.
in that, and
Yeah.
we're also pleased that she's healthy enough to take part in it.
Yes, absolutely. And I was moving on to that item on page 325, which is about the ovarian cancer
I was
awareness
jumping in
campaign that we seek. I seek agreement here to forward the response to Una Crudden for information, given her involvement, obviously, in the issue. I'm also suggesting, members, that we seek copies of the draft information leaflet that has went out as well, because I think, Pam, you had raised that in the past about the need to get the information correct as well, so that we seek copies of that.
Chair, it
Great.
just shows people power for a very determined, exceptional lady and the influence she's had. So I'm delighted to see this.
Absolutely. Page 327 is a response from the Minister regarding the recent research undertaken by Margaret O'Hagan into the use of complementary medicines in cancer. Seeking agreement here to forward the response to Mrs O'Hagan, who had raised the issue. Page 328 is a response from the Minister regarding the Early Intervention Transitional Fund. Seeking agreement to write back to ask for the membership of the Expert Advisory Panel.
I don't go there.
Page 330 is a response from the Minister regarding John Doherty's proposals for preventing accidents. Again, agreement to forward the response to Mr Doherty.
Great.
And 332 is a response from the Minister regarding the McCollum report recommendations. Again, seeking agreement to forward the response to the all-party group on muscular dystrophy. And 341 is a response from the Minister regarding services for people with long-term brain injuries. Again, seeking agreement to send this to Mrs Newless, who raised the issue with us. Page 346 is a response from the Minister regarding services provided by the National Childbirth Trust. Again, seeking agreement to send that correspondence
Great.
to the Childbirth Trust. 348 is a response from the Minister to the committee's request for information on the RKIA review of unscheduled care.
Good job.
The Minister has advised that the terms of reference for the Regional Task Force to examine unscheduled care have not yet been finalised. I'm suggesting, given the importance of this issue and the timescale, that the committee schedules a briefing from the regional task force before Christmas for an update on progress made. Are members in agreement?
Right, yeah.
Right, yeah.
352 is a response from the Minister to the committee's request for clarification on the meaning of the phase "so long as their needs can be met." That was the issue around the residential care in respect of residents remaining in statutory residential care homes. I'm asking members if they're content to note for clarification. 353 is a response in relation to the Pavilions elderly care development that the committee visited. Seeking agreement to forward the response to Mr Law, who raised the issue with us.
Right.
354 is again a response from the Minister regarding the adult safeguarding legislation. The Minister has advised that he is currently considering the Commissioner for Older People's report, which calls for legislation to be introduced. The Commissioner has also written to the committee on this issue. It's on page 761. I think that this is a significant proposal, and I welcome the fact that the Minister is actually considering the calls for legislation to be introduced. So I'm suggesting that the committee schedules a briefing with the Commissioner and the Department on these issues going forward. Suggesting also that the committee takes evidence from Professor John Williams, who spoke at the launch of the report. Some members attended, about the Welsh experience, and I'm suggesting that we invite him to the committee as well to take the evidence. Thank you. 355 is a response from the Minister regarding the number of people removed from the Social Care Council's register during the period of delay in bringing forward the bill to amend the Health and Personal Social Services Act. I'm asking members if they're content to note the information.
Right.
357 is a response from the Minister providing an update on the future of the Belfast School of Dental Hygiene. I'm seeking agreement to forward this response to the British Society of Dental Health and Therapy, who raised the issue.
Right.
357 is a response from the Minister providing further information regarding progress against the Department's led 2011-15 programme for government targets. The one thing I would seek agreement for in this is that there was reference to 11.4 million that was shifted from the acute sector to the community sector. I'm seeking agreement to request further detail on how that 11.4 million was shifted and where it was spent.
Right.
361 and 363 are responses from the Minister providing details of the money that has been recouped through the pharmaceutical price regulation scheme. Again, I'm seeking agreement to forward the responses to the Queen's Cancer Centre, who raised this issue, obviously, and also to seek agreement to write back to the Department for clarification on when the methodology for apportioning 2014-2015 payments will be made. The second correspondence indicates that it hasn't confirmed how much that allocation has been or how it will be apportioned. So I'm suggesting that we seek clarification on that,
Could
Jim.
I also ask that we sent Rusty Foster in Cancer Focus, who also raised the issue with us and who have lobbied us extensively on this issue.
Yep, agreed.
Yep,
Roy?
This is an area I don't understand. We're obviously involved in the scheme, so we get discounts, or if there's overpayments. So why is there an argument over whether or not the 38 cancer drugs which are included in the scheme are available in Northern Ireland? Because if we simply use them, the budget would go up, and guess what? We would get the discounts back again. So I think we need to process that further to get an explanation from the department of why those 38 drugs are not available.
Farrell, yep.
Just on that point, and this has been rehearsed publicly in the media and everywhere else, there was a different scheme in January, and that 1, 2, 3, 4th paragraph, the method for apportioning 2014-15, I assume refers to that new deal. So there are bigger questions to be asked than just simply the apportionment. And I would take issue, because I've talked to the PPRS, or the organisation who negotiated with the NHS nationally on this, and they say that it does extend the medicines licence after 31st. 13, as I understand it.
Okay.
So there are some issues, we need clarity on this issue.
Would members be in agreement that we bring the department on for an evidence session on this issue?
Agreed.
Yeah,
And
definitely.
the ABPA.
Okay. Are members in
Yeah.
agreement with that?
Agreed.
Yeah.
Yep.
Great. Yeah.
Thank you. Page 361. No, I've just dealt with that. 361 and 363. Apologies. 366 is a response from the Minister regarding the companion travel passes for those accompanying blind and partially sighted people, and seeking agreement to forward this response to the Newry and Mourne Visually Impaired Society, who had raised the issue.
Great.
Item 14 is correspondence. Again, members, there's 42 items of correspondence in the meeting folder and 2 items in the tabled papers. Again, in the interest of time, I'm going to just draw attention to several of the items. 383 is correspondence from the Minister attaching the latest version of his department's programme for government delivery plans. I'm informing members that a briefing with officials on the department's PFG commitments will be scheduled later in the autumn.
Yeah, Chair, are we on, what about 439? Could we talk about or ask for more, it's in relation to the development of a clear implementation for population plans for the transforming your care. Could we ask for more transparency on where the money is being transferred from the health budget to transforming your care? I mean, we talked about this earlier.
Is this, sorry, just so I'm clear,
Page 439.
439, this is the PFG delivery plan?
Yes.
Okay, and the clarification on what, Kieran, sorry?
We need to know and have more transparency on where the money is being transferred from the health budget to transforming your care.
Okay, and would that be under commitment 80?
I'm not sure, but I'm reading it from 439, just to
Well, we can seek that update from the department, Kieran, and then part of this, we'll schedule a briefing specifically with the department on their delivery
okay, that's
date.
fair enough, yeah.
Is that okay? Jim, had you indicated?
No, that's fine.
Okay. Okay, members, pages 449 to 451 are in relation to the department's legislative programme. The Minister has advised that he intends to conduct a 12-week consultation on the draft Health Miscellaneous Provisions Bill in the near future, with the intention that it will be introduced to the Assembly by February 2015.
Yeah.
The legislation will potentially ban the sale of e-cigarettes to under 18s. Go ahead.
I mean, again, this is page 449. Could we ask for clarification on the anticipated timetable for the mental capacity bill, given that the public consultation has closed recently?
Okay, we can seek that, but in relation to this specific one around consultation in terms of the health and social care or health miscellaneous bill, we are going to seek a briefing from the department. But yes, we can clarify the process around the mental capacity bill as well. Asking members to note item 14.5. Due to a technical fault, this was just removed from the main meeting pack. So it is on your table papers now on page 61 for information. Page 611 is correspondence from the Minister advising that he has agreed for the Department of Health in England to undertake a UK-wide consultation on proposals to introduce proportionate language controls for nurses, midwives, dentists, dental care professionals and pharmacists applying from the EEA, with the intention that the legislation will come into force by summer 2015. Again, seeking agreement to write to the Department to request an update when the results of the consultation are available.
Great.
614 is again ministerial correspondence advising of the Department's intention to consult on primary legislation for the use of service user identifiable information for secondary legislation. So again, seeking agreement that we request that officials attend a meeting to brief the committee on this matter.
Great.
667 is correspondence from the Minister providing an update on the position in relation to UK-wide legislation which will allow schools to stock asthma inhalers for emergency use. The statutory instrument will come into force on the 1st of October 2014. Can I ask members to note that correspondence?
Right.
Again, 681 is correspondence from the Minister regarding the Nursing and Midwifery Order 2014, which will apply here and in Britain. The order is planned to come into force on the 11th of December. The primary purpose of the legislation, the amendments, is to ensure greater consistency in decision making and to reduce the time it takes the Nursing and Midwifery Council to deal with fitness to practice cases. So again, I'm asking members just to note this correspondence.
Right.
686 is correspondence from the Minister regarding another consultation on GMC adjudication reform order, seeking agreement to request an update from the Department again when the results of the consultation are available.
Right.
689, again, the Minister's correspondence on the proposed General Dental Council.
He's a hard-working minister, isn't he?
He is a very
No, he's been sitting
hard-working,
all of July, right,
very,
please.
very busy,
Very hard.
responding to the Health Committee.
Thank you,
Seeking agreement to request an update from the Department when the results of the consultation are available.
Right.
695 is correspondence from the Minister advising that a private members' bill is being taken forward in Westminster regarding a patient safety and includes 2 provisions which relate to the regulation of healthcare professionals. To help ensure a consistent approach to healthcare regulation, it is intended that these measures should apply on a UK-wide basis.
Here, that's good news.
The regulation of healthcare professionals is a devolved matter, and as such, a legislative consent motion would be required for these 2 provisions. Seeking agreement to request that officials attend the meeting to brief the committee on the matter.
Right. Right.
What was that again?
699 is correspondence from the Minister, another UK-wide consultation on the proposed Health and Care Professionals Order. The proposed order sets out proposals for the statutory regulation of non-medical public health specialists. As only one non-medical public health specialist has been identified here, I may want to ask members to note this item just at this stage.
Right.
719 is correspondence from the Committee for Justice to the Minister requesting his views on the Justice Bill. They've also asked if this committee has any views. I'm suggesting the committee requests a copy of the Minister's submission to the bill and at that stage considers whether it has anything further to add.
Right.
749 is correspondence from the College of Emergency Medicine. In July, they launched a report with 13 recommendations. On page 62 of the table papers is a press release which the college released yesterday regarding exit blocks at emergency departments. I'm suggesting that we write to the department to ask for its views on the issue of exit blocks and on the 13 recommendations and how it intends to address those issues.
Right.
Page 759 and 761 are requests from the Commissioner for Older People to brief the committee on carers assessments and adult safeguarding legislation. Obviously, these are 2 important issues, but we need also to be mindful of our workload and strategic priorities. As we discussed earlier in the meeting, I'm suggesting the committee actually schedules a briefing with the Commissioner on adult safeguarding legislation, along with the Department, to seek their views on the issue.
Right.
And 770 and 771 are requests from Optometry, NI and Family Voices forums requesting to attend the committee stakeholder event, which is scheduled for the 8th of October. Are members content to invite these groups to the event?
Right.
Right.
And 774 is an invitation from Newry Hospice for the committee to hold a meeting there and tour the facilities.
Noted.
Are members content to consider?
Hold on. I think that's a very good idea. We've
Right,
been to Foyle,
Doc,
we've
you've
been to
never heard.
Sullivan Road,
Newry Hospice.
and we haven't been,
Oh, right.
not in my time anyhow.
Sorry, just a point on that. It's a southern area hospice, so it covers.
Yeah, it covers all the
Big area,
southern.
just
We're never out of the southern area.
So
just
totally
about
agree,
Gordon,
Chair.
It's
Yeah, I
not
think
just
we're good.
Newry.
Look forward to
If
it.
we wish to organise an additional meeting and visit there, I have no objection.
Yeah, and I think so. Are
An
members,
additional meeting, noted that.
Don't be getting grumpy.
members are content to consider that invitation alongside other ones received, and
Right.
you know we will be discussing further visits and invites, suggestions around, for example, the new health and social care centres as well. So we will be reflecting on all of that. Item 14.36 is a request from Marie Curie seeking sponsorship for its proposed event in the Long Gallery on the 2nd of March 2015 to launch the Great Daffodil Appeal. Seeking agreement then to note the remaining correspondence unless members have any comments that they wish to make. Fergal.
Chair, just on one issue, and I'm looking for it in my pack. In relation to this Sir Liam Donaldson review, I mean, we spent some considerable time earlier talking about perception of conflict of interest around the safeguarding board, and you know, it appears to me, at least, Sir Liam will be looking laterally, if you like, at information provided to him by the trusts and others, and doing an analysis of that. If we were to maintain the same threshold, surely Sir Liam should be looking right back to the start of the process and not be relying on information provided to him by trusts who are centrally involved in the issues around failed SAIs. So I think we need to look at that issue, and see if there are is there a common concern that we share about whether Sir Liam can adequately up with robust conclusions, given that he will be presented by evidence from those who would be under, if you like, scrutiny around the accountability aspects of SAIs.
I mean, the issue I would add to it is, well, who else has the information about serious adverse incidents?
Yes, but that's okay, but that doesn't get us over the accountability aspect. Perhaps we should send somebody, or somebody should be sent in separately to look at that. These are serious issues about deaths in hospitals.
Are you suggesting, just so I'm clear on what you're suggesting, is there a specific evidencing with the department on the look-back exercise? I think it's page 348 is the response from the Minister, both on the on-schedule care issue and the serious adverse incident look-back exercise?
Yeah. Just a few seconds.
Because I know that what we had said going through those papers, that I had raised the issue about the terms of reference for the regional task force isn't even completed or concluded yet, and that we schedule a briefing from that regional task force before Christmas. Are you suggesting something else?
He's taking work on as the basis of a look-back exercise. And the evidence in that look-back exercise is potentially being done by some of those people or organisations which are involved at the centre of the SAI process. And I'm just wondering, should we not have a process that goes right back to the start? And given, as I say, the exercise that we engaged in around this, the safeguarding board and the threshold that we demand around accountability and all the rest, should we not expect the same there?
Well, is it something that the committee want to seek a view from the department on and raise this as an issue?
Yeah. Sure.
Roy, did you want to indicate there?
I personally think it would be useful if I could have some information about how serious adverse incidents are handled, to seek reassurance that there's no way of brushing them under the carpet. I mean, how are they organised? How do you ensure that there is independence and that those that it's not possible for anyone to hide such a process? I recently got involved in one as a constituency issue, and I think just be useful to know that, or to seek reassurance that there's no way they can be tucked away or hide away, that there will be learning when such instances occur. I would have thought there should be an automatic mechanism for ensuring that they're listed somewhere, and then, you know, what's the process of ensuring independence in any investigation that does happen? I would like to know that. I don't know. And if we get that, that may actually deal with Fergus's issue. It may not. It may lead on to somewhere else that it's not been handled.
I mean, for example, in the next answer, there's a reference to the fact that 3 of 13 deaths within the emergency department, they were reported to the coroner retrospectively, but we've no indication about the extent of that. Was it months? Was it years? Was it as a result of people asking questions? What was the...
And one wasn't reported? And one wasn't reported?
But sorry, that was a stillborn case. That's your requirement.
No. On top of this one stillborn?
Oh, sorry. I just think there are question marks there over the Donaldson review and the way that the department is set about approaching it.
Okay, and I think Gordon had indicated, and then I think the clerk.
No, another issue, just no.
Okay, well, Heather on this
Chair,
issue.
just to advise that the department has advised me that the Chief Medical Officer would wish to come up and brief the committee to provide an update on the Donaldson investigation. Now, they haven't given a date yet, but I would imagine looking sort of at mid to late October. So I don't know whether those concerns
Well, they
can
could be touched on there, yeah.
perhaps be addressed at that
If
session.
we could maybe have a briefing as well, which may deal with us avoiding asking obvious questions that could just be dealt with by correspondence.
Okay, members okay with that? Gordon had
Chair,
indicated.
just
yeah.
on 786, that's a request from Barry Turley to have a formal presentation to the committee on the DNAV diabetes guidance services. We've skipped over that, have we? Or
Well, we did, we noted it, just unless members had comments to raise.
could we offer them the opportunity to come to the short sessions? Would that not be an alternative?
The stakeholder event?
Yeah,
I think
yeah.
that would be appropriate, yeah. Members will agree we can do that, sure.
Right, thank you.
Okay, thank you, Gordon. Okay, members, I think finally, unless there is any other business,
It's just a little thing. I know that this week's meeting was, well, unusually large, but not unusually large for the first meeting back after recess. But just in the chair's brief, when you're going through it, if you could refer to the agenda points, 14.3, 4, 5, it's easier to keep track of when you're
Okay.
only using a tablet.
yeah, okay, no, point
appreciate
taken.
it.
Okay, thank you. Date and time and place of next meeting is next Wednesday, the 17th of September, starting at 2 p.m. in room 29 here. Thank you.
Tommy, you're always going to photocopy.
She can use her.
I'm looking after the environment.